The management of erectile dysfunction tends to be almost like a ladder that a patient climbs up. Now, the first thing to do when we see patients with erectile dysfunction is try, to the best of our ability, with the patient to understand what the potential reversible causes are. Is the patient overweight? Do they smoke? Is their alcohol intake far more than it should be? These are all things that can be addressed even before you start thinking about medications. The next step, of course, once all those things have been optimized, including things like diabetes, we very often see patients with diabetes presenting with erectile dysfunction, I beg your pardon. And the most important thing to do is manage their diabetes, get it absolutely right. So once you've done the weight, stop smoking, manage the drinking, manage the diabetes, you then move on to interventions that we can make in clinic. The most common intervention we make is tablet treatment. Tablets like Viagra, if not Viagra itself. The next step, if Viagra fails for patients, which unfortunately sometimes it does, is to try things like injection therapy or vacuum device therapy. Injection therapy isn't for everybody, and we appreciate that, because the idea of injecting the penis every time you want to have intercourse isn't appropriate for everybody. It also takes away from the spontaneity, which again we understand. That of course happens with vacuum therapy, and to a degree it happens when people have to take tablets and try and plan sexual intimacy. If all those treatments fail, or indeed a patient doesn't want injections or vacuum therapy, the next step would be penile implant surgery.